Hey, welcome back to PrettyWell. I'm Dr. Angela.
I'm Dr. Patty.
So in this video, we're going to do some reminders about PMS. We did a video about a year ago on PMS, but it's really common and a lot of us suffer from the myriad symptoms that are part of the PMS kind of, profile cluster or whatever. And so, some of the common things that fall into the PMS category are water retention, irritability, moodiness or edginess,
Or depression,
low mood, cramps,
breast tenderness.
Yep, boobs hurting. So, these are really, really common symptoms that most of us have one or several of. So we thought we would just do some reminders on how to prevent this, minimize this, make it go away really quick. So what are some of your faves in terms of dealing with PMS?
Well, I really love to do fish oils and plant oils.
Yep.
So doing actual fish oil, omega-3s, and if you are plant-based, vegan or vegetarian, you could substitute an algae oil or a perilla seed oil. And then also doing some evening primrose oil.
Yeah, EPO is great. Works really well even for the breast tenderness ladies, so it's a good one.
And keep an eye out because I'm actually going to do a video soon on seed cycling and how to cycle these oils as well. So keep an eye out for that. But in the meantime, taking some fish oil, taking some evening primrose oil, I found that to be helpful for myself and for my patients.
Yep. And then back to some of our favorite, I feel like we say the same nutrients over and over again because they're so good for so many things, but B6, vitamin B6 and magnesium are the two great, nutrients that really take out PMS very quickly, help us prevent it, get rid of it. Those two are just good ones.
And really helps with some of that irritability and moodiness, sadness.
Cramps too. Yeah, the cramps, it's a big one for cramps.
Definitely. And then as far as herbs, we love our Vitex, also known as Chaste. And, sometimes PMS comes from a little bit of a hormonal imbalance. So in addition to repleting yourself with some lost nutrients, also taking an herb like Vitex to help balance that estrogen progesterone imbalance.
Yep, can help with very regular ovulation, so progesterone levels coming up to help us with any of that estrogen dominant stuff that's so common with the PMS edgy.
Absolutely.
And then I don't know about you, but I am just the queen of pelvic stagnation feelings. When I do have PMS, it's like this just like heavy, boggy uterus feeling or just
bloated,
achy. Yep. And so blood moving herbs, Gingko is a really good one for that. That can be really helpful for just moving along kind of stagnant chi, as we'd say in Chinese medicine.
Any kind of that congestion that you get with PMS and water retention, the bloated, the heavy feeling, the Gingko is really helpful for that.
Yeah.
So these are just some very simple, easy things that you can try, a little bit of a foundational treatment plan for PMS. And, I like to remind patients and friends and myself that when it comes to anything menstrual and hormonal, although sometimes you will experience relief from symptoms right away, sometimes it takes a good 3 cycles for our body to actually incorporate all these and heal, depending on how far off we are, how far off balance we are. So do be patient and give it a few cycles, but you may also feel better right away, as many do.
And, a lot of times this is because it took a while to build up how out of balance we are. Maybe we've had stress for months or, we've been
years. Months. I don't know about you.
That overwork thing that we tend to do, not taking vacations.
And with that in mind, we mentioned a few of the common symptoms that so many of us women suffer from in terms of PMS, but it is a syndrome. It's not a disease. And there's actually over 150 documented symptoms related to PMS.
A lot.
And because it's not a disease, it's multifactorial. It's not just physiology. It's how much rest we're getting, societal pressures. There's so many things involved in it. So
the lifestyle that affects the biochemistry, and it's chicken or egg, like what came first.
Yeah. So, but try out these things that we just mentioned. Like I said, it's a nice base, foundational place to start. And then we can go deeper from there. So thanks for stopping by, for commenting below. Let us know if there's other questions you have or other topics you want to discuss. And we're just wishing you good health and balance, and we'll see you back here soon.
Thanks for tuning in, community. We'll see you back here soon. Looking forward to all the questions and comments, and always check out that description box. All right, see you soon. Bye.